Preview.
Hey, Dr. Joe here from Full Function Rehab. Another IG segment we're going to do today is talking about tennis elbow. So what is tennis elbow? Well, tennis elbow is actually pain right on the outside portion of your elbow. It's also known as lateral epicondylitis, which is the medical term for it, but everybody calls it tennis elbow. And you may get it even though you've never played tennis, you don't play tennis. And the cause of this is just a repetitive strain injury. And we lead to significant pain, we lead to some potential soreness in that area. You can't grip, you can't open a door, you can't shake hands, and you can't use your mouse, you can't type, just because of the significant pain you're experiencing. Very normal, very common. Unfortunately, it becomes very troublesome to fix because of the fact how most people that enter our offices, they come in a couple weeks, couple months after it's set in, or where they continue to overuse the area, which isn't a problem. I mean, we're all human. We all want to try and see if things will go away on its own. Unfortunately, it does cause the problem to set in. The inflammation sets in a little bit more, and it could become harder to treat. It may take longer to treat as well. So what is tennis elbow exactly? So all the muscles that control our wrist to extend, okay, all attach right in this general location, which is why any extension of the wrist or any gripping can cause pulling and strain and tension all in this general area. Very localized. It could also refer a little bit down the forearm, but it's very local here, very tender to the touch, extreme pain. That's tennis elbow or lateral epicondylitis. The attachment point of all those muscles forms a big tendon into this region, and that tendon becomes irritated, becomes inflamed, and develops adhesions in the area. So it's very sore and it's just not comfortable. So there's a lot of things that you could do to help treat it at home. Definitely I'd recommend putting some ice on the area just to calm it down, reduce some stress, reduce some inflammation. That's primary. And then you want to do a little bit of stretching to the wrist to help combat that. So if the problem is caused by extending the wrist, you want to flex the wrist and drop the shoulder down as well to get a nice pulling discomfort down into the forearm. Another thing you can try doing is a little bit of some self-massage, things like that to help treat it. What I like prescribing to a lot of my patients is getting a really good tennis elbow brace. Okay, the tennis elbow braces, they work really well as well because they help reduce the angle of pull right off of the actual bony attachment. Okay, so every brace has its own benefit. The different braces I've seen come in different varieties, from drugstores to performance braces that we carry, medical braces, things like that. They're all kind of performing similar, just different bells and whistles, just like any vehicle or anything like that. And they do work really well, so you could definitely try that for those chronic sufferers of tennis elbow pain. However, those people who are acute flare-up or even a chronic sufferer, we could definitely do some treatment or go find treatment anywhere else that you need to, because it does help and it is needed. You're going to need some exercises to help strengthen the area, calm it down, reduce some inflammation, reduce some swelling, potentially do some modalities like ultrasound or laser or shockwave therapy based on what's actually happening to the tendon. Cases may even require an ultrasound from going to see your family physician. They'll send you to go for an ultrasound to really determine how much inflammation is in there and if anything else needs to be done, or if there's a potential tear based on the injury that occurred or how it did occur. So different scenarios, different cases cause for different treatment methods, and definitely get it checked out. You can try some home care, but that's exactly what tennis elbow is. It's just pulling, tension, very repetitive movements usually cause this area to become uncomfortable, and yeah, that's something you could try to do at home. Oh, one thing to consider is most people who are working from home, your home office is not set up with proper ergonomics, and that poses a problem on all joints. So whether it's your shoulder, your elbow, your neck, your back, any case like that. So you have to consider the angle that your shoulder's in, the angle that your wrist is in, if there's support on your wrist, if there's a good mouse that you're using, because that can definitely offset the elbow and increase tension in that area. So a couple things to consider, okay? So some home exercises, some home stretching, some icing, changing the ergonomics to help combat this issue. Thanks.